Hi, welcome to Pauline Young's channel. If you like our videos, please click the like and the subscribe buttons. In this video, we are going to talk about the healthcare sector in Malaysia and why we think that this sector is a hot sector to invest for 2021. This video has three parts. First, we are going to talk about the Malaysia healthcare industry and its global trend. The second part, we are going to identify which are the Bursa Malaysia stocks that are associated with the industries. And the third section, we will compare their financial ratios and to rank them accordingly. First part, the global outlook of the healthcare sector. Why do we think that healthcare sector is important and it should be part of every investor's portfolio is because of the following driving forces. The driving forces of the proliferation of the healthcare industry are globalization, aging population, the high-frequent spread of contagious diseases, technological developments such as 5G and AI, medical health system with low costs and high efficiencies, and surplus of real estate causing developers to embrace the healthcare elements as a marketing strategy. According to the statistics, from 2019 to 2023, health spending is expected to rise at a more robust compound annual growth rate of 5%, up from 2.7% in the 2014 to 2018. All regions apart from North America are expected to see an average spending growth accelerate in the forecast period, with the largest annual increases in the Middle East, Africa 7.4% and in Asia 7.1%. Global healthcare spending as a share of the GDP will likely remain at around 10.2% through 2023. With the 2019 global population of 7.7 billion expected to reach 8.5 billion by 2030, meeting health needs won't be easy. However, Asian countries will likely also contribute around half of the global growth in higher income households. Population growth combined with increased economic power and efforts to expand public health systems will likely result in higher health spending. Providing healthcare to the rising aging population is likely a key concern for the governments and the health systems. The number of people aged 65 and above will be more than 686 million, or 11.8% of the total population. Spending on the global geriatric care market will likely exceed $1.4 trillion by 2023. Malaysia has an internationally lauded healthcare system that is accessible to nearly all of the population. The success of the country's healthcare sector can be attributed to the investments in world-class facilities, resulting in both private and the public hospitals providing specialist services in addition to training medical practitioners abroad. The healthcare sector operates on a two-tier system, a government-based universal healthcare system and a highly effective private healthcare system. The sector is expected to grow to 127 billion ringgit by 2027, fueled by increasing demand for healthcare services from an aging population, rising affluence, and increasing life expectancy. Malaysia has some of the lowest medical fees in the world, some 40% lower than the US and the UK, with the government subsidizing up to 98% of the healthcare costs. The country allocated 29 billion ringgit towards healthcare in the 2019. To reduce this financial burden, the government has encouraged further private investment in recent years, recognizing the economic multiplier effect of the medical industry. The areas of potential growth are the medical tourism, the manufacturing of medical devices, pharmaceuticals, and clinical research, among others. This makes Malaysia a potential health service hub in ASEAN despite fierce competition from its more established neighbors in Singapore and Thailand. Medical tourism. Malaysia is on track to become the preferred destination for medical tourism in the ASEAN. From seeing 640,000 medical tourists in 2011, the country attracted more than 1 million medical tourists in 2019, earning revenues of more than 1.8 billion ringgit. This was an increase from the 1.5 billion ringgit gained in 2018. In 2005, the Ministry of Health established an agency called the Malaysia Healthcare Travel Council (MHTC), designated to facilitate and promote the country's healthcare travel industry by establishing public-private partnership at home and abroad. The MHTC provides an all-encompassing service to foreign clients, such as providing localized outreach through representatives' offices in Indonesia, Vietnam, and Myanmar. Their services also extend to assisting the procurement of medical visas in conjunction with the Immigration Department of Malaysia. Malaysia is famous for all affordable healthcare, with more than half of all medical tourists traveling to Malaysia were Indonesians, followed by patients from India, Japan, China, the UK, the US, and the Philippines, attracted by the affordability of the treatment provided. Furthermore, with Indonesians spending over $1 billion annually in medical tourism, the country is seen as an important target market for Malaysia's medical tourism sector. Malaysia shares many religious and cultural aspects with Indonesia, providing specific amenities to reach out to halal-conscious patients, such as gelatin-free products. Catering to such requirements has resulted in a gradual shift from Indonesian customers to seek treatment in Malaysia as opposed to the traditional hub in Singapore. Next, we are going to talk about the Bursa Malaysia healthcare sector. Under the Bursa Malaysia, we have identified 2 subsectors and 6 industries. Here is the table. First, let's take a look at the pharmaceutical industry. Malaysia's pharmaceutical industry is valued at more than $1 billion in 2019, comprising of over 100 companies who can be roughly categorized into 3 categories: generic drug manufacturers, the research-based pharmaceutical companies, and the over-the-counter OTC manufacturers. Increasing demand for pharmaceuticals is fueled by increasing health literacy, an aging population, and a rise in non-communicable diseases like diabetes, hypercholesterolemia, hypertension, and other related medical conditions. Local generic manufacturers are only able to supply 30% of these domestic demand, with the remainder being covered by imports. The Bursa Malaysia stocks are engaged in the research, development, or production of pharmaceuticals are Dua Pharma Biotech Berhad, Pharma Niaga Berhad, Kotra Industries Berhad. Next is the halal pharmaceutical market. Malaysia is working itself to be a pioneer in the manufacture, certification, and distribution of halal pharmaceuticals. The global halal pharmaceutical market is set to be worth $174 billion by 2025. Bursa Malaysia companies operating in this industry are Chemical Company of Malaysia, CCM Berhad, Dua Pharma Biotech Berhad, and Pharma Niaga Berhad. The second industry is the biotechnology. Biotechnology refers to the companies primarily engaged in the research, development, manufacturing, and/or marketing of products based on genetic analysis and genetic engineering. Includes companies specializing in protein-based therapeutics to treat human diseases. Excludes companies manufacturing products using biotechnology but without a healthcare application. The Bursa Malaysia stock that is related to this industry is Nova Wellness Group Berhad. The third industry is the life sciences tools and services. Companies enabling the drug discovery, development, and production continuum by providing analytical tools, instruments, consumables and supplies, clinical trial services, and contract research services. Includes firms primarily servicing the pharmaceutical and biotechnology industries. The Bursa Malaysia stocks are YSP Southeast Asia Holding Berhad, Apex Healthcare Berhad, Malaysian Genomic Resources Center Berhad. Here is the summary table of the subsector pharmaceuticals, biotechnology, and life sciences. The next subsector is the healthcare equipment and services. In this subsector, the first industry we are going to look at is the healthcare equipment. Manufacturers of healthcare equipment and devices includes medical instruments, drug delivery systems, cardiovascular and orthopedic devices, and diagnostic equipment. The Bursa Malaysia stocks are LKL International Berhad and the Nova Pharma Solutions Berhad. The next industry under the healthcare equipment and services is healthcare supplies. Manufacturers of healthcare supplies and medical products includes eye care products, hospital supplies, and safety needles and syringe devices. Malaysia exports of medical devices were valued at $5.6 billion in 2019. According to the Association of Malaysia Medical Industries (AMMI), over 90% of the medical devices manufactured in the country are exported, with over 50% of these going to the US, Germany, Japan, and China. Moreover, Malaysia supplies 60% of the world market for medical gloves and 80% for catheters. The Bursa Malaysia stocks are Top Glove Corporation Berhad, Harta Lega Holding Berhad, Supermax Corporation Berhad, Kosan Rubber Industries Berhad, Care Plus Group Berhad, Advanta Berhad. The last industry under this subsector is the healthcare facilities and services. It also includes companies providing business support services to healthcare providers such as clerical support services, collection agency services, staffing services, and outsourced sales and marketing services. The Bursa Malaysia stocks are IHH Healthcare, KPH Healthcare, TMC Life Sciences, TDM, Optimax, Metro Healthcare, Top Vision Eye Specialist, LYC Healthcare, SmileLink Healthcare. And here is the summary table for the healthcare equipment and services sector. Next, we are going to rank these stocks according to their market capitalization. Healthcare sector top 10 big market cap company. Top Glove topped the list of the largest cap healthcare stocks in Malaysia with 53 billion ringgit, while IHH is the second largest capitalization healthcare stocks with 49 billion ringgit market cap. In terms of the PE ratio, the glove stocks have the lowest PE ratio with Top Glove 12.9, Supermax 15.5, and Kosan 19. The ROE tells you how profitable the company is as a percentage of the shareholders' fund. Again, the glove stocks perform better in this category with Top Glove top the list at 74.6%, Supermax 57.5%, and Care Plus 43.7%. Profit margin is high for the glove stocks. Supermax 41.4%, Top Glove 38.3%, and Harta Lega 26.1%. In terms of dividend yield, Top Glove topped the list with 6.7% of dividend yield. Price to book ratio tells us how far the market price is deviate from its book value. IHH traded closest to its book value with 1.85 times, followed by KPJ 2.1 times book value. Investors generally like cash-rich companies. In this category, IHH topped the list with 4.2 billion ringgit, while Supermax 2.3 billion ringgit and Top Glove 1.2 billion ringgit in cash. Debt equity ratio tells you how much debt as a percentage of the shareholders' fund. Top Glove and Apex Healthcare scored well in this category with less than 10% of debt to equity ratio. Finally, let's take a look at the small cap healthcare stocks in Bursa Malaysia, and we rank them also according to their market cap. Among the small cap healthcare stocks, Advanta and LYC Healthcare suffered negative earnings, while Malaysian Genomics, MGRC, and Nova Wellness scored quite well in terms of the financial ratios. They have the lowest PE ratio, the highest profit margin, and zero debt. MGRC PE ratio is 7.1, ROE is 173%, profit margin is 304%, debt equity is 0, and the Nova Wellness PE ratio is 20.2, ROE is 15.3%, profit margin is 37.1%, and it is also a zero debt as well. The above analysis is for information purpose only, and we do not initiate a buy call or a sell call. At the point of recording, we do not hold any of the stocks mentioned in this video. Thank you.